I became a dentist for several reasons, but primarily I like helping people and I like serving. And there's a little bit of artistic flair to it as well, so you can kind of create things, you know, a tooth is not a tooth is not a tooth. It's, you know, you can make it really match and you can change people's lives with a smile and all those things. And then the other thing is I've always liked the atmosphere of a dental office, you know. As a matter of fact, most of our patients come in and they talk about the laughter that they hear here. It should be fun. I mean, it's a scary place. I mean, dentistry has kind of a scary, kind of a overtone to it. I became a dentist to have more time with my family, to have some time off and to really be a husband and a dad. And secondly, I was probably not I don't know where this would fit in, but certainly I believe God called me to be a dentist too. I believe that's been the direction of my life. I've known I wanted to be a dentist since I was 10 years old. And so I geared my whole life to become a dentist. The most rewarding part is, one, serving people and being able to serve them in a way that, one, you take away their pain. You know, so we serve them in different ways. We take away their pain. They're have an infection or something. So that's very rewarding because they go from pain and discomfort to, you know, back to having a normal life again. In 1987, I went to ASU Jonesboro for 5 years. Graduated there in 1992. And then I went to LSU in New Orleans, the School of Dentistry. Graduated there in 1996. I went to LSU primarily because they would get me in the clinic the fastest. In other words, they would allow me more time to learn how to treat patients. And they got, of all the schools that I had access to, LSU got you in the clinic the fastest. And that's what I wanted to be, was the best clinical dentist to be able to help and take care of people. Continuing education-wise, I'm kind of a continuing education junkie. When I got out of school, I just made a list of all the things that I felt like I was deficient in, and then I just started checking off that list as I went to enough education to get that part. And it started with children's dentistry and endodontics, the root canals. And then it went from there to orthodontics, putting on braces, straightening people's teeth, making their smiles pretty, making their bites right. And then from there, it's gone into implants and dentures and things like that. So just constantly going to learn.